secondary IOL and a fourth row pupiloplasty. This poor guy had this iris defect for years. He's pseudophakic, but with a very significant spherical refractive error. So first of all, I implant a secondary sulcus lens. He has a hydrophobic lens in the capsular bag, so this is a hydrophilic secondary lens. You cannot mix hydrophilic and hydrophilic lenses. Then I start my pupiloplasty. I do a fourth row pupiloplasty as my standard technique. It's a fabulous technique. I use the handshake technique for passing my suture across the eye. I appreciate there are multiple ways to do it. In this case, we're going to do 4 individual sutures to achieve a nice round, appropriately sized pupil to solve this gentleman's glare issue. Another alternative here would have been a artificial iris in the sulcus. That really wasn't needed. He had good iris tissue here. For some reason, it had just not working anymore. He had had trauma in the past. So you'll see I've done one of my sutures to correct the pupil. I do a second one here, so second pass and tie that one. So I'll do the temporal one there, still a fairly large defect. Again, my fourth row pupiloplasty there. After that's all done, I've got a nice pupil. Also a little bit of bleeding. I've done a little bit of IA, irrigation aspiration, hydrate my wounds, and nice visual result at the end with an appropriately sized pupil, big enough to give him decent night vision, spherical refractive error corrected, and he was very, very happy indeed.